I will be presenting on chronic obstructive pulmonary disease, which is also called COPD. COPD has three types: chronic bronchitis, emphysema, and asthma. Chronic bronchitis, what is it? It's a type of COPD, as stated earlier. It causes inflammation of the bronchioles in your lungs, and it causes excess mucus production due to your hyperplasia of your mucus glands and bronchometastasis. It's classified as chronic once you have had acute for longer than 3 months for a period of 2 or more years. So this is why it's called chronic, because it's long-term. Acute would be sudden onset. This patient will have a problem getting air into the lungs, so inhaling. Causes of chronic bronchitis include, first of all, smoking, and then pulmonary disorders, like having acute bronchitis. Signs and symptoms of chronic bronchitis would be blue bloaters, so this person displayed on the right of your screen. There would be cyanotic, so blue in appearance, because of their hypoxemia, which is decreased oxygen content in the blood. And to compensate for your decreased oxygen, the patient will have polycythemia, which is increase of red blood cells. To compensate for the lack of oxygen, they want to create more red blood cells to increase the affinity of hemoglobin in your blood. They also have a decreased ventilation and an increased cardiac output to push the blood around your body faster. They'll have a productive cough, also known as smoker's cough, because one of the first causes of chronic bronchitis is smoking. They also have mucus production due to the hyperplasia of your mucus glands. Testing and treatment of chronic bronchitis include a chest x-ray, a pulmonary function test, a sputum culture, which will rule out acute bronchitis, which is caused by bacteria. If the sputum does not have bacteria in it, you know that it is finally chronic bronchitis. And they will test their O2 levels in their blood due to the hypoxemia. Treatment would definitely include to stop smoking, which is the first course of treatment. Then you can use inhaled bronchodilators and oxygen. Next, emphysema. What is it? It's alveolar destruction, because your alveoli have little grape-like sacs in your lungs, but the walls of them begin to deteriorate. So instead of having grape-like sacs, it's just more of singular bags, which decreases your surface area for gas exchange. So you are getting less gas exchange in your blood, which can lead to increased CO2 in your body, and that can lead to respiratory acidosis, the opposite of chronic bronchitis. This person is able to breathe in and out, but the gas exchange is where the problem lies due to the decreased surface area of the alveoli. Causes of emphysema would be first or secondhand smoke, so similar to chronic bronchitis, but opposite in the pathophysiology of it. It's also caused by genetics. Signs and symptoms. Pink puffers. Their ventilation will increase and their cardiac output will decrease. They'll have an increased respiratory rate to try and compensate for the loss of gas, and so they want to breathe in and out more gas, so that's why their respiratory rate would increase. They will have clubbing of their nails and a barrel chest due to the increased pressure in their lungs. They also have a cough. Testing and treatment. Testing includes a pulmonary function test, but their tidal volume of their lungs will decrease, a chest x-ray, or an arterial blood gases test, which, as stated earlier, that will cause respiratory acidosis due to the buildup of CO2 inside. Treatment would be to first stop smoking, and by all means do not give a patient with emphysema oxygen, because it will lead to collapsed lungs. Lastly, asthma. What is it? It's an inflammatory airway disorder caused by constriction of your bronchi. Your mast cells are releasing too much histamine, which causes an inflammatory response, which causes the constriction of the bronchi. This patient will have a problem breathing out, which is also the opposite of chronic bronchitis. Causes of asthma would be allergies, upper respiratory infection, exercise, genetics. But mostly they haven't determined a core factor as to why asthma is caused. These are mostly just triggers. Signs and symptoms of asthma would first of all be wheezing, and then it would be difficulty breathing out, which causes respiratory acidosis because you're not breathing out all of the carbon dioxide in your body. They'll have a mucus production, and in their breathing, they will use their accessory muscles to try and compensate for the constriction, so they'll be using their pectoralis major, minor, sternocleidomastoid, etc. Testing and treatment would include a pulmonary function test and a chest x-ray. Treatment would include bronchodilators, which are inhaled, and they would mainly try to avoid exacerbating the symptoms. These are my references. Thank you for watching.